Scalpel. The word cut through the silence of operating room number 4 at Massachusetts General Hospital, just as the instrument itself would soon cut through the patient's skin. Dr. Marcus Thorne extended his hand, feeling the familiar weight of metal as the scrub nurse placed it in his palm. The surgical lights shone intensely on the motionless body of Thomas Eldridge, a 53-year-old man who, until 48 hours ago, believed he had nothing more than a particularly persistent backache. Now, anesthetized and unconscious, he was about to undergo emergency surgery to remove a tumor on his spinal cord that could leave him permanently paralyzed. Beginning initial incision at 2:17 p.m., announced Dr. Thorne for the recorder that documented each procedure. His voice was calm and controlled, as it had been throughout his 15 years as a neurosurgeon. Everyone's eyes in the room were fixed on the surgeon's hands that had been photographed for medical journals, hands that performed procedures other doctors traveled from across the country to observe. "Ain't nothing but a thing," Marcus muttered to himself, a phrase he always repeated at the beginning of each operation, a small personal ritual dating back to his days as a resident. It was something his father, a mechanic in the Bronx, used to say before fixing cars that other mechanics had given up on. The surgery proceeded as planned for the first hour. The team worked in perfect synchrony, like a well-rehearsed orchestra. Dr. Lisa Chen, the anesthesiologist, monitored the patient's vital signs. Melissa Rodriguez, the circulating nurse, already anticipated each need. Dr. James Wilson, the senior resident, observed attentively, waiting for the moment when Dr. Thorne would invite him to take over part of the procedure, a testament to the mentor's confidence in his abilities. "Retractor," Marcus requested, and the instrument was placed in his hand before the word had even finished leaving his mouth. That's when he saw it, a small detail that didn't appear on the MRIs. The tumor wasn't just compressing the spinal cord, it had grown wrapped around the anterior spinal artery. Removing the tumor without damaging the artery would be like defusing a bomb blindfolded. "What we got here is a situation," said Marcus, unconsciously quoting the character from the movie he had watched the night before, trying to distract himself from the pressure of the next day. "Dr. Thorne," Dr. Chen's voice carried a silent question. Marcus took a deep breath. "Tumor is adhered to the anterior spinal artery. This just got a whole lot more interesting." Interesting. The word surgeons used when they meant potentially catastrophic. The tension in the room immediately increased. Dr. Wilson leaned in a little closer, adjusting the focus of his surgical loops. Melissa Rodriguez discreetly made the sign of the cross, a habit from her Puerto Rican grandmother that occasionally emerged in moments of greatest tension. "Should we close and reconsider our approach, Doctor?" Thorne asked Wilson, his voice betraying the apprehension he felt. It was a sensible suggestion. Many surgeons would opt to interrupt the procedure, conduct more tests, perhaps even transfer the patient to a center specializing in cases like this. Marcus looked at the tumor through his loops. Backing out now would mean weeks of waiting for the patient, weeks during which the tumor would continue compressing the spinal cord, potentially causing irreversible damage. Thomas Eldridge was a single father of 2 girls. In pre-operative conversations, he had mentioned he was teaching his oldest daughter to drive. "Can't wait to see her get her license next month," he had said, with a nervous smile, before the surgery. "We're already in," Marcus finally responded. "And Mr. Eldridge doesn't have the luxury of time." The following minutes passed in absolute concentration. Marcus worked millimeter by millimeter, carefully isolating the tumor tissue from the vital artery. Sweat began to form on his forehead, but he couldn't afford to take his hands away from the surgical field to wipe it away. "A little suction here," he requested, and Melissa quickly complied. The room remained silent except for the regular beeping of the cardiac monitors and the occasional request for instruments. Everyone felt the weight of that moment, the kind of moment that defined careers, and more importantly, lives. That's when it happened. The monitors began to emit alarms, and Dr. Chen announced what everyone feared: BP dropping, heart rate increasing. "It's bleeding," Marcus immediately identified, observing the red fluid beginning to obscure his field of vision. "Suction, more suction." "Systolic down to 85, informed Chen, her voice professional but urgent. The next 30 seconds were a whirlwind of coordinated activity. While Marcus worked to locate and control the bleeding, the rest of the team mobilized to stabilize the patient. "We're losing him," said Wilson, his voice tense. It was at that moment, with his hands literally inside a man's nervous system, trying to prevent him from dying or becoming permanently paralyzed, with alarms sounding and the entire room holding its breath, that Dr. Marcus Thorne said something no one in that room would ever forget. "Thomas," he spoke, as if talking directly to the unconscious patient in front of him, "your daughter still needs those driving lessons, so you and we ain't going nowhere until she gets that license." The simplicity and intimacy of those words created a strange moment of calm in the midst of chaos. And then, as if the universe responded, Marcus located the source of the bleeding, a small vessel that had been stressed by the manipulation of the tumor. "Got it. 40 silk," he requested, and with a precise movement, he managed to contain the bleeding. "BP stabilizing," announced Chen seconds later, returning to normal parameters. The collective tension in the room gradually began to decrease, like air escaping from a balloon. Over the next 2 hours, Marcus meticulously removed the tumor, managing to preserve both the spinal artery and the patient's neurological function. When he finally stepped away from the operating table, his back ached and his hands were stiff from being in the same position for so long. "Procedure completed at 5:43 p.m., he said to the recorder. "Tumor successfully removed with no apparent damage to the spinal cord or arterial structures." In the recovery room, hours later, Marcus was at Thomas's bedside when he began to wake from anesthesia. "Can you feel this?" he asked, lightly touching the patient's foot. Thomas, still groggy, nodded weakly. "Wiggle your toes for me." The toes moved under the sheet. "Good," said Marcus, feeling relief course through his body. "That's real good, Mr. Eldridge." 2 days later, while making his morning rounds, Marcus stopped by Thomas's room. The patient was sitting up in bed, considerably more alert than the last time he'd seen him. "Dr. Thorne," said Thomas, extending his hand. "My nurse told me things got a little dicey during the surgery." Marcus smiled, shaking the patient's hand. "Nothing we couldn't handle." "She also told me something else," continued Thomas. "Said you talked to me during the operation, something about driving lessons." Marcus was surprised. He hadn't expected his small diversion during the critical moment of surgery to have been shared with the patient. "The OR staff talks too much," he responded with an embarrassed smile. "No, I'm glad they did," insisted Thomas. "My daughter Alicia has her driving test scheduled for 3 weeks from now. We were working on parallel parking maneuvers before all this happened." He gestured toward his own body. "I was worried I wouldn't be recovered in time." "Well, the way you're healing, I'd say you'll be well enough to sit in the passenger seat and panic appropriately when she tries to parallel park," joked Marcus. Thomas laughed, then grew serious. "Thank you for not giving up on me in there." Marcus nodded, feeling something tighten in his throat. "That's the deal we make with every patient, Mr. Eldridge. We don't give up." 6 months later, Dr. Marcus Thorne was in his office reviewing charts when his secretary announced an unexpected visit. "There's a Mr. Eldridge here to see you. Says he doesn't have an appointment, but wanted to drop something off." Intrigued, Marcus instructed her to let him in. Thomas Eldridge looked 10 years younger than the man who had arrived at the hospital half a year earlier. Beside him stood a 16-year-old girl with her father's same smile. "Dr. Thorne," Thomas greeted him warmly. "This is my daughter, Alicia." "Nice to meet you," said Marcus, extending his hand to the young woman. "I've heard a lot about you." "This is for you," said Alicia, handing him an envelope. Inside was a framed photograph of Alicia, proudly displaying a newly issued driver's license, and a card that simply said, "Thanks for keeping your promise." Marcus looked at the photo, confused. "My promise?" "To make sure I'd be around for her big day," explained Thomas. "The nurses told us what you said in the OR when things were looking bad." Marcus then remembered the words spoken in a moment of intense stress, almost like a prayer or a challenge to fate. "Word gets around," he said, feeling warmth in his face. "The surgical team should really be more discreet." "I'm glad they weren't," replied Thomas. "Sometimes we need to be reminded why we fight so hard to stay alive." After the Eldridges left, Marcus remained looking at the photograph for a long time. In his years of medical practice, he had saved many lives, but rarely had the opportunity to see the complete impact of his work. The stories that continued long after the surgical scar had healed. That night, as he left the hospital, Marcus passed by operating room number 4. It was empty now, the lights off, the equipment silent, but to him, the room was full of voices and promises in moments that defined what it meant to be a doctor and a human being. "Ain't nothing but a thing," he muttered to himself, smiling as he turned off the lights and closed the door. The next day, during another complex surgery, when the monitors began to sound an alarm and the pressure in the room increased, a new nurse looked nervously at Dr. Thorne, expecting to see signs of panic or concern. Instead, she saw him calmly direct his attention to the surgical field with renewed concentration. "What we got here is a situation," he said, almost casually. "But me and this patient, we made a deal, and I intend to keep it." The nurse didn't understand the full significance of those words, but the other people in the room, those who had been present on that fateful day 6 months earlier, exchanged knowing looks, because in the middle of surgery, he had said something no one forgot, and, in the process, reminded everyone why they chose saving lives as their way of living.